In this video, I'd like to discuss what to expect on the day of your child's airway surgery. On the day of surgery, you'll report to the hospital or surgical center where the procedure is scheduled. You'll check in, and then you and your child will be taken back to the preoperative holding area. There, a nurse will assist you in helping your child get ready for surgery. This entails changing into a surgical gown, getting their weight, and vital signs. Then they will review your child's health history, current medications, and any allergies. Next, your surgeon will come visit with you to review the surgical plan and answer any questions you may have. After that, the anesthesia provider will come in as well. They'll talk with you about the anesthesia plan, explain how your child will fall asleep, and what to expect as they wake up afterward. Once you've spoken with anesthesia, your child will be transported back to the operating room. There will be a lot of staff present, trained in working with children. Their focus is to keep your child safe, comfortable, and as relaxed as possible. Your child will be helped onto the operating table and lay down with a pillow for comfort. They'll start by breathing oxygen through a mask, and in most cases, anesthetic medication will also be inhaled to help them drift off to sleep. Once your child is asleep, an IV is placed. Through that IV, anesthesia medications are given. Then their airway is secured and protected in coordination with the surgical team based on the plan that was discussed. At that point, the bed is typically turned and the surgical procedure is performed. Once the surgeon has completed what's needed for the airway, your child is allowed to wake up. The anesthesia provider will turn off the anesthetic medications, and when it's safe to do so, any breathing tube that was used will be removed. Your child will then go to the recovery room to continue waking up and recovering from anesthesia. While your child is in recovery, your surgeon will come talk with you. They'll review what was found during surgery, what was performed, and what to expect during the recovery period. Meanwhile, your child will be monitored closely by the recovery room nurses, watching things like breathing, heart rate, blood pressure, and oxygen levels. Once your child is awake enough and stable, they'll be reunited with you. At that time, the nursing staff will go over postoperative instructions with you and provide written instructions to take home. You'll be able to ask any questions you may have. And that's what to expect on the day of surgery for your child's airway surgery. So now you know. Thanks for watching.